Larva migrans refers to parasitic diseases caused by animal worm larvae that accidentally infect humans. In this video, I will explain cutaneous and visceral larva migrans, including their biology, transmission, symptoms, diagnosis, treatment, and prevention. Cutaneous larva migrans is caused by animal hookworms such as Ancylostoma caninum and Ancylostoma brasiliensis. These worms normally live in the intestines of dogs and cats. Visceral larva migrans is caused by Toxocera canis and Toxocera cati. The parasites release eggs in animal feces, which contaminate soil and sand. In warm, moist environments, the eggs develop into infective stages that can infect humans accidentally. For cutaneous larva migrans, infection occurs when filariform larvae penetrate the skin, usually through bare feet or exposed skin. For visceral larva migrans, humans become infected by ingesting embryonated eggs, often due to poor hand hygiene, especially in children. Common sources include soil or sand contaminated with dog or cat feces. Risk factors for cutaneous larva migrans include walking barefoot on beaches or sitting on contaminated sand. Risk factors for visceral larva migrans include young age, pica, close contact with pets, and poor sanitation. In cutaneous larva migrans, larvae migrate within the epidermis, but cannot enter deeper tissues. They release enzymes that cause inflammation, itching, and the characteristic creeping rush. In visceral larva migrans, larvae migrate through the bloodstream to organs such as the liver, lungs, brain, and eyes, triggering a strong immune response with eosinophilia. Cutaneous larva migrans causes an intensely itchy, red, serpiginous rash, commonly on the feet, thighs, or buttocks. The disease is usually self-limiting, resolving within weeks to months. Visceral larva migrans may be asymptomatic or cause fever, cough, wheezing, hepatosplenomegaly, and lymphadenopathy. Severe forms include ocular larva migrans, which can lead to visual impairment, and neurotoxicariasis, affecting the brain. Cutaneous larva migrans is usually diagnosed clinically, based on the typical creeping skin lesion and history of exposure. Visceral larva migrans is diagnosed using serological tests such as ELISA, supported by imaging and blood tests showing eosinophilia. Treatment for cutaneous larva migrans includes albendazole. For example, albendazole inhibits glucose uptake in the larvae, leading to parasite death and resolution of symptoms. Antihistamines and topical steroids may also be used to reduce itching and inflammation. Visceral larva migrans is treated with albendazole, sometimes combined with corticosteroids to reduce inflammation, especially when vital organs are involved. Early treatment is important to prevent complications such as vision loss or neurological damage. Prevention includes regular deworming of pets and proper disposal of animal feces. Good hand hygiene and avoiding barefoot exposure to contaminated soil are also essential preventive measures. In conclusion, cutaneous and visceral larva migrans are preventable zoonotic diseases. Early recognition, proper treatment, and preventive measures are key to reducing complications and disease burden. Remember, prevent infection, protect yourself and your pets, and seek treatment early if exposed.